Welcome to Special Education with Hamid Naqvi. Let's continue practicing MCQs relating to mentally challenged field. This is a sixth video of its kind. I hope you have gone through the earlier videos as well. First MCQ is which intervention for individuals with intellectual disabilities emphasizes gradual skill development in small steps with regular reinforcement. Lecture-based learning, continuous assessment, task analysis, or self-directed learning. Correct answer is task analysis because task analysis breaks complex tasks into smaller, manageable steps, allowing for gradual skill development and reinforcement after each successful step. Which adaptive behavior skill set focuses on understanding and following social norms as well as maintaining friendship? Practical skills, conceptual skills, social skills, or physical skills? The answer is social skills, and the reason for this is that social skills are vital for understanding social norms, building friendship, and interacting appropriately in a society, especially important for individuals with intellectual disabilities. Next MCQ is which form of reinforcement involves providing rewards immediately following a desired behavior to increase its frequency? Negative reinforcement, punishment, positive reinforcement, or extinction? Answer is positive reinforcement because positive reinforcement strengthens desired behaviors by providing rewards or incentives immediately following the behavior, encouraging individuals to repeat it. Which genetic disorder related to intellectual disability is characterized by delayed motor skills and difficulties with coordination and balance? Prader-Willi syndrome, Fragile X syndrome, Rett syndrome, or Cry-du-Chat syndrome? Answer is Rett syndrome, and we know Rett syndrome often presents with delayed motor skills, poor coordination, and balance challenges, along with intellectual disability, and predominantly affects females. Next MCQ is which type of intellectual disability sport involves providing continuous help across all environments like home, school, and community? Options are time limited sport, continuous sport, intermittent sport, or independent sport. Correct answer is B, that is continuous sport. Continuous sport, as we know, is structured, ongoing assistance available across various settings to individuals who need help with daily functioning in all aspects of their life. Next is which therapy approach involves teaching individuals to replace inappropriate behavior with socially acceptable one? Cognitive restructuring, cognitive behavioral therapy, or behavioral replacement therapy, or applied behavior analysis? Answer is D, that is applied behavior analysis, which is in short known as ABA. And we know ABA is commonly used to teach socially acceptable behaviors, replacing challenging behaviors through reinforcement and structured intervention. Next is which of the following is communication method often used by non-verbal individuals with intellectual disabilities. Dialectical behavioral therapy, positive behavioral sports, augmentative and alternative communication, or verbal instructions only. Correct answer is C, that is augmentative and alternative communication, which is in short known as AAC. And we know AEC includes tools like picture boards, speech generating devices, and sign language to assist individuals with communication difficulties. Which concept involves breaking down a complex task into small, manageable steps to facilitate learning? Cognitive mapping, task analysis, full task presentation, or trial and error learning? Answer is task analysis, and we know that task analysis is technique used to teach complex skills by dividing them into smaller, more manageable steps, especially helpful for those with intellectual disabilities. Which of the following is often a characteristic of mild intellectual disability? Requires intensive support for all daily activities, can perform some work tasks with supervision, has no academic disability, or demonstrates high level problem solving skills. The correct answer is B, that is, can perform some work tasks with supervision. Individual with mild intellectual disability may need some guidance and can often complete work tasks with supervision and perform many basic activities independently. Next MCQ is which area of adaptive skill involves following social rules, understanding interpersonal relationship, and developing friendship? Conceptual skills, social skills, practical skills, and physical skills. Answer is social skills. And social skills involve navigating social norms, interacting with others, and building relationship essential for successful social integration. Next is which intellectual disability is commonly associated with hand wringing movements, seizures, and severe developmental delays, especially in females? Fragile X syndrome, Prader-Willi syndrome, Rett syndrome, or Williams syndrome? Answer is Rett syndrome, and Rett syndrome typically affects females and is characterized by repetitive hand movements, intellectual disability, and developmental delays often worsening over time. Which intervention technique uses rewards to increase the likelihood of desired behaviors occurring in the future? Extension, positive reinforcement, negative reinforcement, or generalization? The answer is positive reinforcement, because positive reinforcement strengthens desired behaviors by rewarding them and making them more likely to be repeated. Which aspect of adaptive behavior includes skills such as hygiene, dressing, and feeding oneself? Answer is social skills, practical skills, community skills, or academic skills. Answer is practical skills. And we know practical skills are daily living skills, encompass self-care activities such as hygiene and dressing, which are essential for independent functioning. Which intellectual disability is caused by a single gene mutation on the X syndrome, primarily affecting males? Turner syndrome, Down syndrome, Fragile X syndrome, or Angelman syndrome? Answer is Fragile X syndrome, because Fragile X syndrome is a genetic disorder caused by mutation on the X syndromes, primarily affecting males, and is common cause of inherited intellectual disability. What is common goal of early intervention program for children with intellectual disabilities? To focus on academic skills only, to identify and address developmental delays as early as possible, to prevent social interaction, or to focus on physical fitness exclusively? Answer is to identify and address developmental delays as early as possible. Early intervention programs we know help detect developmental delays and provide necessary therapies to support skill development from a young age. Next MCQ is, which assessment tool is widely used to measure adaptive behavior and socialization skills in children with intellectual disability? Stanford Binet IQ test, Wechsler intelligence scale for children, Vinland adaptive behavior scales, or Beck depression inventory? Answer is Vinland adaptive behavior scale, and the reason is that it measures adaptive skills including communication and socialization to help assess needs and plan sports. Next, which syndrome associated with intellectual disabilities often leads to a distinctive facial appearance, high social ability, and cardiovascular issues? Williams syndrome, Down syndrome, Angelman syndrome, or Prader-Willi syndrome? Correct is Williams syndrome. Individuals with Williams syndrome often have unique facial features, are highly social, and may experience cardiovascular problems due to genetic deletions. Next MCQ is, which of the following is not a characteristic commonly associated with intellectual disability? Learning difficulties, limited adaptive functioning, exceptional academic performance, or deficit in intellectual functioning? Answer is C, that is exceptional academic performance. Intellectual disability typically involves difficulties in learning and adaptive functioning, not exceptionally academic performance. Next, which intellectual disability is associated with laughter, a happy demeanor, and balance issues? Prader-Willi syndrome, Angelman syndrome, Williams syndrome, Turner syndrome? The answer is Angelman syndrome. Angelman syndrome is characterized by a happy demeanor, frequent laughter, balance issues, and severe developmental delays. Which area of adaptive behavior focuses on time management, communication, and literacy skills? Practical skills, conceptual skills, social skills, or physical skills? The answer is conceptual skills, and we know conceptual skills include managing time, literacy, and understanding language, all essential for independence and personal development. Which behavior intervention involves identifying the cause of challenging behaviors and the implementing strategies to reduce them? Psychotherapy, functional behavior assessment, psychoanalysis, or medical intervention? Correct is B, that is functional behavior assessment, in short known as FBA, and FBA identifies the purpose of challenging behavior and helps in creating strategies to address and reduce these behaviors. Which adaptive behavior includes skills like handling money, using public transportation, and managing personal safety? Academic skills, social skills, practical skills, or conceptual skills? The answer is C, that is practical skills. As we know, practical skills are critical for daily functioning and independence, including tasks like money management and navigating public transport. Which type of intellectual disability is associated with a single gene mutation and can cause severe intellectual impairment, seizures, and lack of speech. Fragile syndrome, Fragile X syndrome, Rett syndrome, Williams syndrome, or Angelman syndrome. Answer is D. Angelman syndrome, because Angelman syndrome is caused by a mutation in the UBE3A gene, leads to intellectual disability, seizure, and lack of speech. Next is which term refers to providing assistance as needed for a specific situation rather than continuous support. Continuous support, crisis intervention, intermittent support, or full-time support. The answer is intermittent support, and intermittent support is provided only when needed, allowing individuals more independence while offering assistance when required. Next is which of the following is an inherited condition that causes intellectual disability and is linked to a mutation on chromosome 15? Angelman syndrome, Turner syndrome, Williams syndrome, or Fragile syndrome? Answer is Angelman syndrome, and Angelman syndrome is often caused by a mutation and chromosome 15 and leads to intellectual disability, developmental delays, and characteristic behavior features. Another MCQ is which strategy involves teaching a behavior in the actual environment where it is intended to be used, enhancing real-world applications? Simulated practice, school-based training, ecological approach, or laboratory-based learning? Answer is ecological approach. The ecological approach uses natural setting to teach skills, making it easier for individuals to apply and generalize the skills in their delays. With this, we come to the end of this sixth video. If you like it, please give your comments in the comment box and share with others. If you have not yet subscribed this channel, please do it. Best of luck in the